Good afternoon, Miss Widette and my fellow classmates, as well as the TAs. Today, I'll be presenting a comparative review of Saccharomyces boulardii in inhibiting Clostridioides difficile infection and other pathogens implicated in antibiotic-associated diarrhea. So antibiotic-associated diarrhea, or AAD for short, is a common complication of antibiotic therapy that results from the disruption of the normal gut microbiota, as antibiotics frequently target both good and bad bacteria. This loss of microbial balance reduces colonization resistance and enables opportunistic pathogens to establish themselves within the gastrointestinal tract. The most common, pathogen that is associated with AAD is Clostridioides difficile. Following antibiotic-induced dysbiosis, C. difficile spores can germinate and release toxins A and B, which damage the intestinal lining and cause diarrhea. Recurrence is also common because the spores can persist after treatment. However, C. difficile only accounts for a minority of AAD cases. Due to limitations in current diagnostic methods, many of the remaining cases cannot be linked to a specific pathogen. Nevertheless, evidence suggests that other bacteria, particularly Clostridium perfringens and Staphylococcus aureus, may also contribute to AAD. And to address this issue, probiotics have been explored as a preventive strategy. Among them, Saccharomyces boulardii has received considerable interest or attention because, as a yeast probiotic, it is unaffected by antibiotics and can be administered alongside antibiotic treatment. However, despite promising findings, most studies have focused primarily on C. difficile infection, specifically the studies that have investigated the effect of S. boulardii on AAD, and therefore it remains unclear whether the protective effects of S. boulardii extends to other pathogens implicated in AAD. Hence, the aim of this review is to compare the efficacy of Saccharomyces boulardii in reducing Clostridioides difficile infection with its ability to inhibit other pathogens implicated in AAD, specifically Clostridium perfringens and Staphylococcus aureus. So let's move on to the methodology. So first, I conducted a systematic literature review using Google Scholar, Science Direct, and Springer Nature Link. The search covered articles published between January 2016 and February 2026 and used keywords related to S. boulardii, AD prevention, diarrhea, and the selected pathogens. Only peer-reviewed English language clinical and experimental studies were included, whereas the non-scientific sources and the studies that are unrelated to gastrointestinal infections were excluded. After screening the titles, abstracts, and full text, 12 articles were identified and 8 met the inclusion criteria. Of these, 4 focused on CDI, while the remaining 4 investigated S. aureus and C. perfringens. So let's move on to the results. So here's a summary of the studies that I selected. So the overall findings suggest that Saccharomyces boulardii exerts protective effects against Clostridioides difficile infection. Most studies reported reductions in CDI incidences when S. boulardii was administered concurrently with antibiotics, with decreases ranging from approximately 40 to 60%. The greatest benefit reaching 76%, was observed in patients receiving high-risk antibiotics such as ceftriaxone. In addition, adjunctive use of S. boulardii appeared to improve treatment outcomes by reducing disease recurrence. Protective effects were also observed against the other pathogens implicated in AAD. Studies involving Staphylococcus aureus demonstrated notable antimicrobial activity, including around 60% growth inhibition, while those investigating Clostridium perfringens reported reductions in intracellular survival and fecal abundance. So now let's compare these findings with other studies. While most of the studies in this review showed positive effects against CDI, Tarek et al. Did a meta-analysis and found no significant reduction in CDI incidence or recurrence within the studies that he analyzed. This discrepancy may be explained by differences in timing of probiotic administration, as delayed administration of S. boulardii within the studies that he analyzed appear to have a, reduction in the potency or effect by S. boulardii in inhibiting CDI. However, for Staphylococcus aureus, the findings were relatively more consistent, as multiple studies reported antimicrobial activity, including growth inhibition and strong autoaggregation and co-aggregation abilities of S. boulardii, similarly to the studies that I have reviewed. So now let's look at the specific mechanisms that S. boulardii has against each infection or pathogen. So S. boulardii inhibits C. difficile mainly through immunomodulation and bile acid regulation. It stimulates the production of immunoglobulins such as immunoglobulins A and G, which help neutralize toxins A and B released by C. difficile that causes the diarrhea. In addition, S. boulardii converts primary bile acids into secondary bile acids, which is important because primary bile acids promote the germination of C. difficile spores, whereas the secondary bile acids actually inhibit spore germination and hence reduce the ability of the pathogen to establish infection. Now, for the mechanism of S. boulardii against S. aureus, S. boulardii appears to mainly act through acetic acid production, autoaggregation, and co-aggregation. Acetic acid has antimicrobial properties and can inhibit bacterial growth, and the co-aggregation also brings S. boulardii within closer proximity to S. aureus, which allows the acetic acid secreted to be more effective. And furthermore, autoaggregation also allows S. boulardii to colonize the gut more effectively and compete with pathogens for space and nutrients. And for the mechanisms of S. boulardii against C. perfringens, the primary mechanism appears to be immunomodulation. The alpha toxin produced by C. perfringens triggers excessive inflammatory responses that can lead to tissue damage. And studies suggest that S. boulardii can actually help regulate the inflammatory cytokine production by reducing tissue damage while still also allowing the immune system to control the pathogen. In addition, acetic acid secretion may also inhibit both the vegetative cells and spores of C. perfringens. However, several limitations should also be considered. Most of the studies on S. aureus and C. perfringens were conducted in vitro, limiting clinical relevance. There was also considerable variation in study design, population, and probiotic strains. In addition, many studies measures pathogen inhibition rather than directly measuring AAD prevention. Therefore, future studies should focus on large-scale clinical trials that directly evaluate the effectiveness of S. boulardii in preventing AAD, and also determine the optimal dosage in which and timing of administration in which S. boulardii should be administered in. So, in conclusion, Saccharomyces boulardii demonstrated inhibitory effects against multiple pathogens associated with AAD through mechanisms including immunomodulation, bile acid regulation, acetic acid secretion, and competitive exclusion. These findings suggest its potential as an adjunctive therapy alongside antibiotics. However, further clinical evidence, particularly by S. aureus and C. perfringens, is needed before distinctive or definitive recommendations can be made. Here is the references. So yeah, thank you for listening.